So just to kind of recap for our viewers, we've been talking about the spine, which is actually connected to the brain. So you all have, in your practice, really looking at that scope of the body and making sure that everything is healthy and taken care of, and then even into the nerves. Is that correct too?
Sure. Yeah, we typically deal with compressive lesions, be they tumors or degenerative processes of the peripheral and central nervous system. Our colleagues, the neurologists, often deal with more diffuse processes and refer us a fair number of patients in terms of the evaluation of the patients, and they often find things that ultimately prove to be surgical as well. But it runs the gambit for us. Okay.
Yeah, I mean, I think neurosurgeons are better known as brain surgeons, but about 80% of what we do is actually spine surgery,
right.
And only about 20% of what we do is brain surgery. So it's a smaller portion actually, but that's, I guess, what we're better known for.
You're right. I was going to say that's the and that's why I was trying to make the connection pretty much with the brain and the spine together, because that actually is a big part of our body and keeps us mobile, makes us be able to do all of what we're able to do, working together and being connected.
Yes.
So we've talked a little bit about some of the preventative factors, some of the things that people can do at home, make sure that they're exercising, make sure that they're eating right, keeping their weight, maintaining within the range, normal range. We've been talking a lot about on Health in the Heartland, making sure that you know what your body mass index is. And that's kind of a good indicator for your height, for your weight, are you where you need to be. So those of you that may not have had that opportunity, you can go to our website, I know at the hospital, www.hmh.net. Click on, there's a BMI calculator to kind of find out where you are, and that may be an incentive to get out and start walking and making sure you're doing some of the healthy tips that we've been talking about today. Also not smoking, that seems to come up quite frequently as something we can avoid, and that's actually one of the #1 preventable aside from wearing your seatbelt, is it not? And you all deal with injuries too, so I'm sure you have some safety tips in making sure people wear helmets and seatbelts, correct?
Absolutely. Helmets for kids on bicycles in the summertime. You know, when I was growing up, of course there was a stigma attached to a helmet, but you know, I think there's been a sea change, there's been a shift, and I see a lot more kids riding around in the neighborhood with helmets on, and it's a preventable thing. Dr. Jackson and myself have definitely both seen bicyclists who've been injured without helmets, and there's a profound difference in outcome when your head is protected versus not. So it's an important thing.
Absolutely, and same thing on a motorcycle, obviously. Skateboarding probably too.
Scooters, I mean.
Scooters, okay.
Yeah, anything that gets you over the speed of running, I think you should probably have a helmet on. I mean, I think these little electric scooters go 15 miles an hour. We had a friend, his young daughter ran into a brick mailbox and had a severe closed head injury on a scooter without a helmet on. If she had a helmet on, she would have gotten up and she would have maybe a broken arm or something like that, but she had a severe brain injury from not having a helmet on, and it's easily preventable. And the helmets are very inexpensive now, and they're everywhere. And like I said, it's not, as Dr. Cole mentioned, used to be everybody made fun of the kid with the helmet on, but now we should make fun of the kid that doesn't have the helmet on.
That's true.
Well, and you both made good points, because I think if you talk to your family and you say, let's go on a bike ride, then everybody puts their helmet on. But sometimes if you're just driving up and down, you know, riding around the yard or in the driveway, you still need to put your helmet on. Close to home is where most of the things actually happen.
My classic example was a lady in a state park. She was not hot dogging or anything. She was just riding her bike. She hit a speed bump, knocked her off her bike. She wasn't going more than 5 miles an hour, hit her head exactly on her temple, and she came, this was at University of Kentucky, she came to UK with a very large epidural. If she hadn't come to the hospital, she would have died from a bike wreck at 5 miles an hour. And then it's also the cars that hit the children. Oftentimes they're not going that fast, but if a car hits them, obviously the car can be going 25, 30, 40 miles an hour, and the trauma from that is much more significant than a bike wreck at 5 miles an hour. But even a small bike wreck at 5 miles an hour can harm you significantly.
Absolutely.
If you don't, if you hit the wrong way. So like I said, people probably make fun of me. I wear my helmet everywhere. My kids wear them at school, I think, but on the playground. But it's very important, and it's something easily preventable. And a close friend of ours, their child just had a bike wreck and hurt her hand, but she broke her helmet, and she would have really hurt her head had she not had her helmet on. That was within the past couple months. So I think certainly I push that. It's very preventable, and it's a tragedy if it happens.
And then, of course, the seatbelt in the car, protecting the spine and the head too. What about, we're at the end of a summer season, but what about diving in pools?
Yeah, unfortunately, diving injuries are all too common. I think that really minding your P's and Q's in terms of knowing where the deep end of the pool is versus the shallow end is an important thing. And I think my experience with diving boards is a lot of people are getting away from them. I think
pools, right.
They're an enormous liability.
They are.
And in terms of, you know, shallow dive, bad problem. We've unfortunately taken care of a number of people who've ended up quadriplegic.
We see it a lot at lakes too, because you can't see. And one of the tragic things, I saw an 18-year-old girl just graduated from high school. She dove off the end of a dock, hit her head on a submerged log, and she's quadriplegic. She could not move her arms or legs, and that wasn't going to come back. And so they say feet first time. Until you know what's there, you definitely don't dive in with your head. You'd rather break your leg than break your neck, I can assure you of that. And so if you don't know, if you can't see, I would just say don't dive, period. But definitely if you're going to jump into something, it's with your feet the first time. And like I said, you hope you don't break your leg, but you definitely don't want to break your neck.
Sure.
So that's always a good piece of advice. And I don't let my kids dive in pools that aren't more than 12 feet deep. I just don't let them. You don't dive. You jump in feet first.
No clowning around.
No, I mean, I've seen, if you see one spinal cord injury in an 18-year-old, it's enough to make you be very cautious about that.
Dr. Jackson and I are pretty boring guys.
Yeah.
Do you let your kids take their helmets off on the swings?
On the swings, yes, but the swings my kids are in they have straps, so they're not escaping.
I'm teasing. Well, we've talked a little bit about the injuries, and what about sports injuries? Helmets obviously there too. Watch safe tackle concussions. Anything
Sure.
there?
We see lots and lots of concussions. Actually, we have a new program that we've implemented with our colleagues, the trainers, and our physician's assistant, Heather Ruscio, in terms of testing athletes preseason and a much more structured environment for getting kids, back to play, but first and foremost back to play with safety. And what we do is we baseline evaluate the patients in terms of some cognitive testing, some mental challenges, and then we test them if they get a hit or have symptoms, and then we follow them. And our colleagues in physical therapy have some strategies that we can implement in order to get kids feeling better and back to play. But there's a new mandate in terms of how we manage these kids. It used to be a little bit more loose, but we have a mechanism in place now with our trainers to get them in a more structured environment and get them back on the field.
And those are the sports medicine trainers that are really working on the sidelines and right there, making sure, working with the coaches and really talking to the parents, because you don't, get back in the game, you're tough. Anymore, the long-term effects, they're finding there's a lot of media attention and a lot that's
it's kind of like a diving accident. You just have to see one kid who got hit really not too bad once and kind of got dazed and then went back in and got hit again and he's in a coma. You only have to see one of those before you say, we really need to be more cautious about this. And I had a friend call last night. Her boy got hit on the sideline. He was complaining of a headache and felt like he was going to throw up. I said, do not let them put him back in the game. I didn't know if they, hopefully there was a trainer there who wouldn't have let him put him back in the game.
Sure.
But I said, if they try to put him back in the game, you go out on the field and take him off, because he doesn't need to get hit again until it doesn't mean he can't go back, but we want to get him back to normal before he does that. It's more of it's not an additive, it's a multiplying thing. If you get hit twice in a relatively short period of time, and it can be devastating. So,
it's cumulative then.
Yeah, it's.
And I think we need to point out, and I was listening to what you were saying with getting hit. It's even the non-contact, such as soccer, and they talk about that being non-contact. And baseball and different things like that. All the sports, we really have to just take a second glance here. First glance,
cheerleading, gymnastics,
anything.
it's all of them. They all have a risk of head injury, and so certainly you want to. You don't return until you're normal.
Right.
And that's just that's in a nutshell. But certainly don't try to tough it out and go back in. I feel good, coach. Put me back in. You want to be honest with your coaches, and the coaches want to you know, obviously they don't want an injury to a child, so they will want to be careful too. But you want to be honest with your coaches and not say, I feel great, put me back in, if you're not feeling up to par, because a second hit could be devastating.
Sure.
Well, and I think we're all very pleased, and I know in our medical profession that there's the national attention, so this is the norm. It's okay.
Oh,
you
yeah.
know, parents, the athlete, the sports trainer, the physicians, we're all working together to really make sure it's the best for the athlete that's out there.
And it's in the professional athletics as well.
Mm-hmm.
So I mean, there's a lot more attention being paid to it, simply based on some of the outcomes of some of the professional athletes that we're seeing in terms of dementing illness at a relatively young age, and professional football players, and just really concerning things.
Excellent information that you've shared with us today, and we've talked specifically about low back pain, talked a little bit about protecting our brain and making sure that we are safe with some of the tips, some health tips as far as making sure we're watching our weight, exercising, not smoking, and then we wrapped up a little bit here talking about concussion safety and making sure not just with concussions, but also wearing helmets and making sure that even sports around our house, riding the bikes and doing different things, that we look at taking care of ourselves and really protecting our brain and our spine. Thank you both for being here with us today, Dr. Jackson and Dr. Cole. We appreciate your time.
Real pleasure.
Thank you. For more information, we'd like to have you go to our website at www.hmh.net. You can find our providers, information about our services, and then also go to HealthLink for more health information. We hope you tune in next month for another edition of Health in the Heartland.